name is Dr. Vera Tarman, and I am hosting the annual I'm Sweet Enough, the September Sugar-Free Challenge. This year, I am interested in asking questions of some of our notable authors in the anti-sugar crusade. Today, we're going to ask Dr. Abrahim, the author of Reversible, a protocol for sustained weight loss and reversal of chronic diseases paperback.
Thank you for having me. My name is Abrahim. I'm a Canadian doctor. I have no financial disclosures. Nobody pays me anything. And I practice medicine. Mostly, I used to do family medicine. And I am assistant clinical professor adjunct at McMaster University in family medicine, and I am involved in research as well. I currently practice emergency medicine and obesity medicine. So I came into obesity medicine from a professional view and also a personal view. So I suffered from obesity all my life since childhood. And eventually I developed the chronic metabolic diseases or obesity-related diseases. And as a family doctor or obese family doctor, of course, that's a bit of a challenge. And that's one of the points I wrote in my book. I dedicated a whole chapter to my story, or Physician Heal Thyself. Because part of family medicine, I'm sure you practice too, family medicine, and you know that part of it is counseling patients on weight loss. So you send them for some blood work and the blood work comes back bad, high cholesterol or diabetes, and then you are required to counseling them on weight loss and some lifestyle changes. And you sit there being a morbidly obese doctor and you counsel your patient. And actually my patients were kind enough not to say like, look at yourself, or can you help yourself first before telling me what to do? Mm-hmm. But the message I was delivering is what I was taught to, the generic advice of eat less and exercise more. I tried that myself multiple times, bouncing between diets and running on a treadmill for hours and nothing changing. And I thought that was a personal failure, that everybody else will succeed except me because I am just a failure or I have no willpower. And the usual self-blame, I would say. Instead of blaming the intervention itself, for some reason we tend to blame ourselves. Then I started to do my own research. And eventually I was able to reverse diabetes and cholesterol, blood pressure, reflux, all the disease I had, and lose the excess weight and maintain it, because I lost weight many times and I regained it again on all the extreme dieting lifestyle that everybody goes through. That kind of like extreme and transient, and the weight comes back eventually. But the key is how to lose it and never find it again, I guess. Yes. So I wrote my book based on my personal experience and based on my patients' stories and what I learned from them. So I named it Reversible, but I'm going to start first with the design of the cover, because it has a bit of a message behind it. So the figure 1 means it's a one disease. They are seemingly different diseases with different names, but they actually stem to one root cause. So that's why the number 1 with all these diseases in it is symbol of one disease. I'm going to get to the root cause of it, but I just want to explain the colors of the cover. It's kind of like a flame of the chronic inflammation. Then the title, I wanted it as a statement to tell people actually it is reversible. Because I'm sure you and me, when we went to medical school, all these diseases we were taught to be life-term disease, irreversible, chronic, progressive. There is nothing you can do about it. It's your genetics and all the conventional message. So by using the title as a statement, I just wanted to give hope and actually information or inform the public, which are not aware of that these diseases are reversible, and some doctors as well are not aware that these diseases are reversible. So on the book cover as well, I wanted to add this line that this is for sustainable weight loss. It's not for a short-term, quick, magical solution. This is for something for long-term. So that's what to expect when you read the book. Then I wrote the introduction, why I wrote this book. There are so many books about weight loss and lifestyle diseases. What do I uniquely present in this book? So the reason is not the lack of knowledge. It's mostly the misinformation and confusion out there. I'm sure you are facing that every day. People will tell you, oh, no, I don't eat sugar. I just eat honey or something like, or brown sugar. Or there is so many confusion. And sadly, some of the doctors and health gurus fuel this confusion by focusing on something that is the root cause of every evil. So I just give an example of the few books because I feel for the public. They are so confused that there is so many conflicting information and books and written by renowned physicians about everything and its opposite. That even we go into tomatoes are the root cause of the problem or something like that. So the definition of healthy and unhealthy, it was the root of this consensus written by Health Canada that there is actually nothing is called healthy or unhealthy. It's for whom and for what disease. So in one chapter, it's called the internal obesity. I quoted the father of modern medicine is to treat any disease, you need to find the cause. Without knowing the cause, you're just treating the symptom. And in my practice, I thought that would be treating, let's say, high blood pressure or cholesterol or any of the chronic diseases will be through some sort of a new drug or intervention that is high tech. But that I was completely wrong. I had to find the unique and individual cause for every person. And that's how I came into the food addiction cause, because I didn't know that until I read your book. I didn't know that there is something called food addiction or anything like that. So I try to dig deep with every patient. If I find the root cause, but the root cause is kind of like generic. So I give an example of this is what is the cause of a disease. So let's say somebody goes to work and they have stress at work, they hate their boss and they go home extremely stressed. They need to deal with the stress and binge on chips or candy. Then based on certain hormonal balances, they get internal obesity or visceral obesity. Then based on that, the fat develops into intrapancreatic fat, called inflammation of the pancreas, dysfunctional of beta cells that produce insulin. Then they develop the disease, which is type 2 diabetes. One of the symptoms of type 2 diabetes is high blood sugar. There are multiple symptoms, peeing too much and all these things. The conventional way of treating type 2 diabetes has been through blood glucose lowering drugs or food. Let's say don't eat carbohydrates or glucose deprivation diets like ketogenic diets and all these diets that focus on the blood sugar. Meanwhile, the actual problem is the fat that is inside the pancreas. And the real problem actually is the root cause, which is work stress. if I deal with the work stress, then I'm dealing with the stress eating and I'm dealing with the internal obesity. Now I reverse chronic disease like type 2 diabetes without any intervention medically and for long term. And that's how I came to the conclusion that the root cause of chronic diseases can be food addiction. I know sugar is extremely addictive, and in meat, I was addicted to sugar, and mostly in the realm of baked pastries and bread, which is, I'm sure you know, with the food confusion, people think that bread is not sugar, or no, I am eating brown bread, or all of these confusing terms, marketing campaigns. So taking back to the root cause of a problem is the food addiction. If I treat the food addiction, I will treat the type 2 diabetes and weight loss as well. Then I went to what is addictive actually? Is it the food, or is it the behavior of addiction? Or is there an overlap between them? And is it the substance, or there is mental health or psychological trauma? So when I remember my first patient, actually in the first day, I just opened the obesity practice. I'm so excited. My first patient, I asked her one question: why do you want to lose weight? And she started crying. Then I couldn't find tissue. She asked me, like, what kind of a weight loss clinic will not have tissue for crying people? So that's one of the things that I realized, that the root cause can be very, very deep and deep-rooted in the psyche of the person, using the food as substance to deal with some sort of stress or psychology. So I came across your book, okay? And I read it, and it fascinated me that it could be the cause of many diseases. And I like your title, that food junkies, not just sugar junkies. There are so many addictive food. So according to the Yale Food Addiction Skills, these are the most commonly addictive food. And drinks, of course. I don't want to rule out the drinks. They are big, big thing. So in my book, I started to find, based on my patient population, is what are the fattening and addictive food, because I treat with the food addiction and the obesity as well. And surprisingly, the acronym FAT, fattening and addictive trio. Fat, sugar, and flour. Because flour, as you know, it's synonymous with sugar as well. So I quoted you that food is the most addictive and cheap drug everywhere. And the food addict can't hide it. They wear it compared to any other drug. Alcohol, nobody can see it. And then I moved into the chapter of mindset, how when we approach weight loss through our thoughts and ideas and perception of what we should do. So I gave 2 examples of dieting mindset, that I have to do something immediate and severe and extreme to lose as much weight as I can in the shortest duration possible, like a race. Or somebody's thinking of a lifestyle mindset, long term. How am I gonna eat and live for the rest of my life, not just for the next week or month? And at the end, I would like to finish my presentation with, because I work in emergency and obesity as well. So in emergency, I resuscitate lives. But I think resuscitation, the quality of life, is something is very, very, very important. And giving hope to people is what actually it gives me the biggest satisfaction. Sometimes even more than resuscitation in the emergency department. And that's about it. That's about my little presentation. Prescribed medication for weight loss. and some people would ask me for exercise plan, I would give them. However, I don't believe that this is the root cause of their problem. But sometimes not everybody would learn from advice. Sometimes they try it. They want to try it. So I'm giving them the prescription of the medication. I'm telling them this is not your problem. But doctor, I would love to try it. Please, please, my friend tried and he lost so much weight. I said, yes, he lost weight and the weight is coming back when they stop the medication. But please, please let me, okay, no problem. And here's the side effect. Most of them, they cause a lot of nausea. And that's why maybe that's how you lose weight, by being chronically nauseous for a few months. And some of them, I don't give them prescription because it's very expensive. I give them a sample because some wouldn't even tolerate the nausea. They can't. It's not even worth it. And some go to the gym and run on the treadmill and do the whole 9 yards. But that's what they want, because some of them, I prevent them from going to the gym because their medical problem doesn't allow to. I think it's actually dangerous for them to exercise until they lose weight and get healthy first. So when it comes back to the diet, I try to work on their diet, on their cultural diet, because my practice is diverse from many, many cultures. So let's say, I'm going to give you an example. For a Chinese person to adopt a Mediterranean diet, it will never be sustainable. He wants to eat his diet and his meals and recipes. So all I figure out is where in his diet there is a problem and fix it. And my main issue with certain foods is something called the net energy. So I explain the net energy in my book, that it's the amount of energy we consume minus the amount of energy we use to digest the food. So that's why the amount of calories we eat doesn't matter. Let's say if we eat 500 calories of raw nuts or 500 calories of peanut butter, let's say, we maybe use about 50% of the energy in it to digest it. And some part of the nuts will come out undigested, and you can see it in the feces or stool. Versus oil, let's say, it's readily available or bioavailable and digestible, and it's so easy for the body to absorb and retain without any energy to excrete or digest. So this is the concept of net energy food. So the more complex food, that's why we try to understand why would people eat complex food will live healthy and lose weight, and people that eat processed food, regardless what it is, versus the calorie counting model or portion control, it's mostly how complex your food is.
Right. Can I just stop you there, just to translate that into some of the language of what happens in the sugar-free group. So the processed food, the industrial food, would fit into the non-complex food, and so you wouldn't support that kind of diet, correct?
I support let's say, I'm going to give you another example of that, because there's so much confusion out there. So I ask my patients, do you eat sugar? No, I don't eat any sugar. What do you eat? Brown sugar. The concept that brown sugar is unprocessed, or honey is natural, unprocessed.
Right.
Or let's say butter or oil or naturally squeezed, all these marketing things. It's very hard to define what is processed, what's not. So if you use complex and simple.
I see. Okay. So you wouldn't even take the stand of industrial food. You're just looking at whether it's complex or not, whether it's real or industrial or whatever.
Exactly. They say if somebody eats butter and olive oil and all these things that seemingly healthy, but they're actually very high in energy. I have actually 2 meals a day. So the concept of to lose weight, you actually need to do something to reduce the amount of food, because it makes huge difference. So that's why maybe the fasting model has a bit of success. If you think mostly it's literally missing a meal. It's if you say that I'm not gonna have breakfast today, or I'm gonna have brunch and dinner, and that's it. So that's what I do. 2 meals a day. My breakfast is whole oats with some raw nuts and fruit, berries or whatever fruit I have. And then I have dinner. It would be a piece of meat and some sort of complex vegetable and salad, and I'm gonna have dessert fruit too. So that's what I personally eat. I don't eat any sugar. I don't eat any oil, any butter, any cheese, any dairy in general. These are
here. If a person says, I'm following keto and I want to eat cheese a lot, I want to eat yogurt every day, I want to eat meat every day and bacon once in a while, what would you say to that?
Actually, I learned that from you, the idea of switching addictions. Within my practice too, if I see somebody's addicted to bread and they say, you know what, I don't eat bread anymore, but there is something, they're still gaining weight. And so I look what have they replaced it with. And usually it's something more addictive or equally addictive.
And would you say that that could be the bacon and the meat and the cheese?
In some cases, yes, but not every case. If somebody finds a regular balance in their life, if they have a small piece of meat and they have some vegetables, there is some key to healthy wine. It's if you eat like green leaves, non-starchy vegetables, and lean meat, eggs.
I noticed that you really focus on the lean meat angle as opposed to just eat as much fat as you like.
Exactly. Because lean meat is complex. It will give you the fullness. It will make your body work hard to break it and extract energy instead of just handing your body highly refined and simple oil. The body doesn't have to work it off. The same thing with the sugar and flour.
Right. Okay. So again, the message that I hear again is that it's not even so much what the ingredient is, whether it's a carb or a fat or a protein. It's the fact whether it's complex or not. Exactly. That's the key piece.
Yes, I think if I summarize my message, is first that it's reversible. It's all reversible, and all you need to do is to know the right way. The right way is through knowing your specific, unique cause, not through a diet. No diet works at all on the long term. They all work on the short term. Every diet have a life cycle of a diet, and that the dieter, their enthusiasm based on where they are on the diet. Are they at the peak of weight loss or the beginning, at the end? But at the end, if something is not sustainable and it's not the cause, it's not gonna last. My contribution will be actually is what I would like to add, is what I'm working on and doing all my research on now, is the relationship between chronic diseases and the internal obesity, not the total body weight. So the total body weight and the body mass index are not the cause. You can be extremely thin or have a small amount of internal fat and you'll be extremely sick.
Yeah. Is there any last words you want to give before I close up?
No, I would like to thank you for all the work you've done, and your work has changed many lives. One of them is me.
Oh, thank you.
Thank you very much. And I'm looking forward for more cooperation.
Thank you very much. Oh, that was great.